Fibroids, they are very important for females, especially if the female is somehow told by any sonologist or a gynecologist that she is having a fibroid. There are various thoughts which come to the mind of a female. If that female is young, 25, 30, 31, 35, and she plans to conceive, then she always thinking whether I should remove the fibroid, whether I should get it removed, whether I should go for IVF, what will happen with fibroid, whether fibroid will affect my pregnancy, how the fibroid impacts pregnancy, do you need to get fibroid removed before IVF, does fibroid lead to preterm labor pain, does fibroid lead to abortion in pregnancy. We'll discuss all these aspects, fibroid and infertility. How does fibroid affect fertility? Good morning, I am Dr. Rajat and you are watching our YouTube channel, The Fertility Gynecologist. So what are fibroids and should I remove the fibroid before getting pregnant? This is the most common question which a female has in her mind when she is planning to conceive, especially if she has been told before that she is having a fibroid. Now, fibroids are benign tumors of uterus, uterine muscle, which in 90 to 95% cases are harmless. They do not do anything. And in most of the cases, they are an incidental finding on our routine ultrasound or transvaginal sonography, which we do for the females when she comes to us for the routine consultation. Now, whether the fibroid needs to be removed, how common are fibroids? They are very, very common. Approximately 10 to 20% of the females have had fibroid at some point of time during their life. So, how the fibroids are diagnosed? Like I said, before the advent of ultrasound, it was an post-operative intra finding or huge fibroid visible through the abdomen or palpable through the abdomen we used to find, but small fibroids it was very difficult to find. But with the advent of transvaginal sonography and the ultrasound, it is very easy to see fibroids in ultrasound, and it is also easily mapped which point at which place in the uterus the fibroid is. We can map it and it becomes easier for us to say whether the conception would be easy, conception would be difficult, which fibroids needs to be removed, which do not need to be removed. So, do fibroids per se decrease the chances of fertility? Before I answer this question, let us understand the anatomy of uterus. This is the uterus. This muscle part is called as myometrium. This part is called as an endometrium. So if the fibroid is inside the endometrium, that is a submucosal fibroid, then there are more chances that this fibroid may affect fertility and that fibroid would need to be removed before she is planning to get conception. If fibroid is inside the myometrium and the size of fibroid is less than 4 centimeter, then and that fibroid is not affecting the endometrial cavity, then the chances that that fibroid may affect fertility are very, very less, and that fibroid may not need to be removed before she plans to conceive. Other type of fibroid is a subserosal fibroid. That means it is outside the myometrial cavity. Even if that fibroid is 5 by 5 centimeter, the chances that that fibroid may affect fertility are very, 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 very less, and that fibroid need not be removed before conception. So whether the fibroid needs to be removed or not, it depends upon A, the size of fibroid, and B, the location of fibroid. Now again, every case has to be individualized. If there is a myometrial fibroid of less than 4 centimeter, but she has undergone 2 times IVF or 3 times IVF or IUI before, or she has had history of abortions before, then possibly we may think that this fibroid is affecting the pregnancy chances, or that fibroid is causing abortion. Then only we can we can think of removing the fibroid. Most of the patients who come to me in OPD and then they ask me, sir, do these fibroids decrease or dissolve by themselves, or is there any kind of medicine which is available to shrink this fibroid? First of all, because these fibroids are hormone dependent tumors, they are mostly dependent upon both estrogen and progesterone. What we have found in our practice is as long as the female is menstruating till menopause, most of the fibroids, they do not regress. After menopause, some of the fibroids, they do regress. As far as medicines is concerned, few years back a medicine called ulipristal came into the market. That medicine gives good results for dissolving the fibroids, but that medicine, as long as that medicine is taken, the fibroids would get dissolved, but the moment that medicine is stopped, there would be again regrowth of fibroid. That medicine, because the fibroid regrows, and during, if the medicine is being taken, the patient cannot conceive. In infertility, we do not use those medicines. So can one have successful pregnancy with fibroids? Answer is definitely yes. Again, like I mentioned previously, whether the female would get pregnant with fibroids or not, it depends upon the location of fibroid. In most of the cases, what we have found is it is intramural, and there are no difficulties of females with conceiving with intramural fibroid. If there is a big submucosal fibroid, then that may act as a foreign body and it will prevent the fertilization and also implantation. That is why with females with submucosal fibroid should get fibroid removed before they want to conceive. Can fibroids cause miscarriage? Now, depends. If the implantation of embryo has occurred on the place where the fibroid is, then the chances are that the blood supply to the embryo would be decreased, pregnancy would be decreased, and that may lead to a pregnancy failure or a miscarriage. But if the implantation is far away from that fibroid, then the chances that fibroid may cause miscarriage may decrease. So again, it depends. It may or may not cause miscarriage. Does fibroid affect the equality or AMH? Answer is a big no. Fibroid has got no relation to the AMH level. AMH level is only related to the age and other factors in female, like if she is having autoimmune disorders, if she is having diabetes, all these factors, they do affect AMH level, but fibroid does not affect AMH level. Does fibroid affect the ovulation of female routine? It does not affect the routine ovulation. Females can ovulate normally, so fibroid does not occur. So how do fibroids cause infertility? Again, fibroid causing infertility depends upon the size of fibroid and the location of fibroid. Say if there is a big huge fibroid, subserosal fibroid here, so what that fibroid may do, it may compress the fallopian tube. If the fallopian tube is compressed, the sperm may not go from here to this place and the egg may not come from here to this place. If the fibroid is a big fibroid or a small fibroid inside the submucosal cavity, again that may act as a foreign body, so the sperm may not go up, so the fertilization may not occur. If there is a big fibroid at the level of myometrium and it is indenting, it is coming inside the cavity but not penetrating the cavity, that may affect the implantation. So these are the 3-4 main mechanisms how by which the fibroid may affect infertility. But even suppose I have seen a patient who is having a fibroid and which is an incidental finding, I am the first person to tell the patient that she is having a fibroid. Even with fibroid, we will give a good reasonable trial of 7, 8, 10 months, provided she is of younger age and her AMH is normal, to let nature do its work. And because most of the patients do conceive with fibroids, we have seen many patients when we operate on when we do a cesarean section on table, we see many cases of fibroid which was not told to the patient before, and during pregnancy, if the patient is coming to us at 7, 8, 9 months, it is difficult to know the size of fibroid unless it is very, very big. So what size of fibroid is normal? See, till 3-4 centimeter size, most of the females can conceive naturally, normally, so we do not need to worry. If it is more than 4.5, 5 centimeter size fibroid, then it may affect pregnancy, and then only we may possibly think of getting it removed. So the removal of fibroid is called as a myomectomy. It can be done either through a laparoscopy or through an open surgery. Both surgeries are good. If it is a small fibroid, we usually prefer a laparoscopic surgery. It is a keyhole surgery. A small scar is kept, incision is put on the uterus, we reach the fibroid, remove the fibroid, and then close the cavity. But if it is a big fibroid, say about 5, 6, 7 centimeter, then usually we prefer the open surgery. because during the open surgery, once the fibroid has been removed, because fibroid has a pseudo capsule around it, that bed of the fibroid, myometrial bed, needs to be closed properly, and there should be no dead space, because that dead space, if there is a there will be lead to blood collection during the healing process, and if there is a more blood collection, there would be more fibrosis, and more fibrosis means when the patient conceives, there would be more chances of rupture during pregnancy. And that is because unless somebody is a very expert laparoscopic surgeon who has a good who has done multiple myomectomies and multiple myomectomy closures, dead space obliteration is perfect. Routine gynecologists should stick to doing a open myomectomy with a good dead space closure, multiple layer closure, so that the less fibrosis is there, and that may affect less, there may be less chances of rupture in the pregnancy. So suppose a patient has got a myomectomy done, how long after a myomectomy she can plan to conceive? The healing of scar of myomectomy takes 6 weeks, and we normally advise at least 2 to 3 months before the female should start conceiving for pregnancy. Suppose we have done a myomectomy before IVF, then how long can she conceive? Can she undergo IVF again after, or embryo transfer again after myomectomy? Again, the answer remains the same. Approximately 6 to 8 weeks minimum time has to be given for the scar to get healed. So can one do IVF with fibroid in situ? See, if the patient is undergoing first IVF and there is only small fibroid which is intramural, and it is the endometrial cavity is not being disturbed, then the chances are that that female can do IVF with fibroid in situ without getting fibroid removed. That person may go for a trial of a ulipristal at least 12 weeks before, so that the size of fibroids gets shrunken, or there may be certain GnRH analogs like decapeptyl or leupride, so that the fibroids get shrunken before IVF. But if female has undergone previous 2-3 IVFs and those have resulted in failure, or there is a history of abortion before, then possibly with fibroid we may not advise IVF. We may advise the removal of fibroid before doing for an IVF. Does fibroid affect implantation? Answer is yes. If the fibroid is at a site, submucosal fibroid, it is at a site where the embryo is going to implant, then the answer is yes, it may affect implantation. Sometimes the fibroid are in the lower uterine segment. So, and if we want to go for an IVF for an lower for that patient for some other reason, that embryo transfer may get difficult. So again, every case has to be individualized, where the fibroid is, what is the age of the patient, what is the previous history of the patient, what treatments patient has undergone before. Submucosal fibroid are usually removed by hysteroscopic surgery, that is called as hysteroscopic myomectomy. Again, if the fibroid is absolutely whole fibroid is inside, then that surgery is relatively easy. But sometimes the fibroid is only 25% inside the cavity and rest 75% is in the myometrium, so we cannot remove the whole fibroid at a single sitting. So there may be multiple sittings required for that fibroid. Again, it requires experienced hands to do a hysteroscopic submucosal fibroid myomectomy. It is a difficult surgery. Suppose we knew that patient has fibroid and patient conceives and patient comes to us with pregnancy. So are there any chances that fibroid may affect pregnancy? Fibroid may affect pregnancy. In some cases they can lead to preterm labor. In some cases patient comes with bleeding. If there is a fibroid in pregnancy, then we are extra careful. We give extra doses of progesterone, extra doses of dydrogesterones. Progesterones may be given in form of tablets, pessaries, injectables. Sometimes if the cervical loss, internal loss and external loss, the cervical length is less, we may go for a stitching. These patients are prone to preterm labor. Sometimes the red degeneration of fibroid occurs in pregnancy. The patient may have excessive pain, sometimes fever in pregnancy. So these are complications are there, but most of them are manageable. Most of the females come and ask me, can I do something to stop the growth of my fibroid? Answer is no, one cannot do anything. The only thing what we have found is if the female attains menopause, then possibly the chances are that estrogen dependent fibroid may reduce in size, and most of them they do shrink by 10, 15, 30% after menopause. But we cannot do anything by ourselves to decrease the size of fibroid. How to take care of early pregnancy with fibroid? I've told extra bed rest, extra progesterones. If 12 weeks everything is fine, cervical length is relatively less, and fibroid is in the lower uterine segment, maybe we can go for cervical encerclage. Can you carry the baby to full term with fibroids? In most of the cases, answer is yes. But again, I mean, it would be sound cliched, but it would depend the where the fibroid is in the pregnancy. If it is a intramural fibroid and the cavity is not being abated, then the chances are that the patient may go to full term. If it is a broad ligament fibroid, again the patient may go to full term. Again, if it is a cervical fibroid, also patient may go to full term, but the cervical fibroid patient cannot deliver normally. The cesarean section has to be done, and that cesarean section is technically difficult if it is a cervical fibroid, because we normally put the incision in the lower uterine segment. So that is a topic for the different debate. But if it is a submucosal fibroid, and with submucosal fibroid the pregnancy has patient has conceived, then the chances are there that they may not reach to the full term. But otherwise, what we have seen in most of the patients, females do reach to the full term. Any role of vitamin E or D with fibroid? Per se, there is no specific role of vitamin E or D with fibroids. But what we have found is vitamin D deficiency has been found in patients with fibroid. But vitamin D deficiency is almost universal nowadays, because we all live in AC mostly. We do not go out in the sun mostly. So there is no harm in correcting the vitamin D deficiency. And vitamin E, it is an antioxidant anyway. There is no harm in taking vitamin E. But few studies have found that vitamin E supplementation might have some effect, but again they need to be confirmed. So this was our small video about fibroids in pregnancy. Please like the video, subscribe to the channel, and share the video. Thank you. Bye bye.